Thank you so much for joining us for this interview. We really appreciate it.
Oh, I'm so glad to be here and have this opportunity to speak on these issues about kids in Rhode Island and who are in our child welfare system. I mean, I think the more we talk about it, the more ideas will come in to help us fix it.
How do you think the state of Rhode Island is doing when it comes to taking care of our most vulnerable children?
Well, I think I would lead with this because I know if there's a tragedy and it's in the newspaper, it's easy to forget the complete heart and commitment of frontline staff who are part of DCYF, who I would like to think are part of our court system, who work for agencies such as Adoption Rhode Island, the dedication of foster parents and mentors who volunteer their time. We have such strength in the state, and I wish that our resources could match the dedication of the people who are serving children in Rhode Island. And by that I mean not even financial resources, because right now, probably first time in any of our memory, we do have a lot of economic resources, but what we're facing is very similar to what's in the healthcare field, which is that it's hard to staff positions, it's hard to retain people. This work became so exhausting and challenging during COVID, and now we're dealing with the aftermath of situations that weren't coming to light because of COVID. And it's just when we're losing staff because of that exhaustion factor. And if I had to say, I would love to see the state at the level of our educational system, DCYF, which I think is turning a page with a chapter of really investing in this light, of just starting to invest upstream so we make these careers even in teaching, in being a social worker, in working in a group home. They need to pay what they are supposed to pay to retain people and to reflect that you can't put a price on what it means for a child to find a mentor in a group home, or have a social worker who takes the extra time with them, or makes appropriate referrals through Adoption Rhode Island. I mean, but we need people, not just how big can your heart be if you're already in this job? You can still only do so much, and by that I mean the people fulfilling those positions.
So you're saying we have the heart to take care of the children.
Absolutely.
We have the resources to take care of the children, but we don't have the people to fill the positions.
And I think the other thing is we need to invest and recognize there's a mental health crisis for our youth, and that our need for placements out of the home where they can get clinical care so that they can safely reintegrate into their own families with appropriate support. I think this has never been at such an acute level. I mean, the statistics about teen suicide, we've unleashed marijuana in all these different forms at a strength that's unknown to previous generations that kids have access to, which is, I think, particularly dangerous for kids in early developmental stages. And so we have more acute need than ever at the same time where we have fewer placements for children. And that's something I know that our Child Advocate's Office and our Chief Justice, Chief Fort, has really made a commitment to addressing. But we're on track to add 16 beds. I can't tell you, I mean, every judge on the family court calendar sees many more cases with that level of need in a day, much less a week, so I think investing has got to be at every level to address this. So we're going to have a generation of kids without and within our system who are really struggling in a way that we haven't seen before.
We are facing a mental health crisis, and children are included in that.
100%.
What happens when children come before you, need some kind of service, but can't get it?
Well, I think what's happening more and more, and it just pains me to be the messenger on this, but we're having to cast the net further and further away from Rhode Island in terms of finding suitable placements for children who have high-end clinical needs, are a danger to themselves or even their families, and really need that acute attention, and yet can't stay close to home. So more and more we find ourselves, judges on the bench, hearing that the best placement for this child is in Arkansas or in Oklahoma. I mean, I'm speaking literally. And I think as Rhode Islanders, to think how much we have an aversion to even traveling to the counties, or anywhere within the state, to think that it's suggested to parents that the best place for their child is in Alabama, this is uncharted waters, so and yet without being able to offer anything here, the court and DCYF are, obligated to find a service somewhere. So it's a real dilemma.
So are local families actually taking you up on that offer and sending their children to Alabama, Arkansas?
They are, and it's not, and I think that, one of the initiatives I'm aware of that the Child Advocate's Office is going to pursue is making sure that we have Rhode Island eyes on those out-of-state placements by adding to the visiting and the investigation, because if we're going to send our kids there, we don't want to say, geez, Detroit's nice at this time of year. We want to say this service matches this child's needs, or else we wouldn't even suggest such a thing. I mean, who could be comfortable with sending their child, such a distance? And yet that's where we are. And I say, let's build it here. We have expertise. There are, within New England, those placements are full because every state is facing this same mental health crisis for youth.
So are you pushing for that now, to build some kind of facility for boys and girls who need help?
Yes, and I think the whole court, it's our Chief Fort's role to push, as it were, not the rank and file, but we would certainly chime in recognizing the need and just supporting every initiative that can add beds here in Rhode Island. Because I think even if it's the best placement in the world, if it's far away, you can't do the family work. And so that's where, it's sort of like a Hobson's choice. And so, to address the acute, immediate situation, and that's where I think sometimes it falls on the court to order, still have a visitation schedule so the child can remain connected to their family. I mean, this is only humane, and yet it's, just broadening the enterprise to a degree that, we really haven't dealt with before. I mean, I think in past years, going to Vermont was thought of as a really far away placement, and now we're speaking about the Midwest, the South, and I have a lot of mixed feelings about it, but if there's not beds available and we're, telling DCYF you have to find something, I can't take it back once that need has been identified.
How common is this? How many children are going without services right now in Rhode Island?
Well, I couldn't give you a set number, but I know that waiting lists for placements are probably at record levels, and particularly for girls. And I think that, there are even situations where a child who needs a placement for clinical needs and has an offense that's landed them on the so-called juvenile delinquency calendar is in fact waiting at the training school for an appropriate placement, which is, the last thing we want. That's a last resort, and yet, there's a safety concern that's to such a degree that, the judge hearing that case says, geez, you better find something for me because the child doesn't belong at the training school, but I can't return them to their home safely, so.
Right now there are kids at the training school who really shouldn't be in there.
I think that's a fair statement. And I am not on the calendar that sentences children to the training school presently, but I have been on that calendar, and I think that, it should be the last resort. We should find the least restrictive environment with the most clinical services for any child who's been identified to have those type of needs, which quite frankly, with our recognition of trauma, is almost every child in the system. And I think it's the perfect storm of not investing in creating those beds here, and then this tidal wave that COVID and this mental health crisis for youth has brought to us.
What are the consequences of not getting a child the services that they need?
I think that, I think most people would regard it as common sense. I mean, you get out of anything what you put into it. And so if we don't invest in these children at these critical developmental stages, they're not having the opportunity to maximize their potential emotionally or intellectually. I mean, they fall behind educationally because they can't maintain a level of equilibrium in a typical school setting, and we don't have anything else to offer them, you know, unless we can have a placement that has an educational component. So, you know, I think reap what you sow, you know, and I think that this is going to follow a generation of children who are in care and out of care in a way that's going to be, you know, something not experienced before for a generation of youth. And I'm not a pessimistic person at all, but I just think, you know, sound this alarm, take it really seriously while we still have a window to, you know, try to address some of these things and take action here in Rhode Island.
You say we're getting 18 additional beds. How many more do we need?
I think that what would be, and it's completely anecdotal, so I don't profess to have a spreadsheet. That's not really the role of the court, but I think that if we could add 50 beds for adolescent girls who, you know, traditionally haven't been in placement as frequently as boys, you know, but then we had the whole horror of discovering the sex trafficking that was taking place. So we started to fill up beds with girls for other reasons, and then the trauma, a recognition of trauma that led to the need for placement for girls that really was unprecedented. And, you know, now I don't want a girl or boy to be malingering in Hasbro or Bradley for want of a bed, but unable to return to their community in a safe and productive manner. And we really need, you know, something that I am so proud of the initiative of our chief and of the legislature supporting this and really taking the lead. I mean, you know, Senate President Ruggiero and you know, the House members who have taken the lead with making sure that we get a facility built. But you know, it's kind of like saying, you know, the floodwater's at your ankles and we're working on the ark, you know? I mean, it's not, you know, I applaud the effort, but it has to be, we can't just say, oh, we're building one of those when it's 16 beds. You know, that's not going to cut it. We have to be thinking always one step ahead so that we don't lose these girls and boys. And I just say, I mean, I have a 20-year-old and I have a teenager, you know, I mean, in real time amongst their classmates, you see how, you know, they don't seem to have the ease of past generations. They have so much more income and they have social media. They have so many things that's making it harder for them. And that's for a child in a stable family, much less a child who, you know, for whatever reason has needs that lead them to be part of the child welfare system. You know, we cannot drop the ball. Kids get one chance to be a kid. You know, maybe you say, oh, geez, I went to college later in life, or I changed careers. Kids only get one career to be a kid. You know, we have to get it right for them in this window of time, or at least know that we've tried our best.
We see more and more young people getting into gang violence, shooting each other. What's feeding that? What's causing that?
Well, I mean, once again, I'm not, you know, in a role where I know of a statistical nexus, but I think, once again, common sense usually does you right, and that's that, you know, guns are so much more widely available. And, you know, this is, once again, this is anecdotal, but, you know, for whatever reason, during COVID, many people, out of just concern of the unknown, you know, purchased weapons that they then forgot about that are in a bedroom drawer. And guess who finds it? Kids. You know, we in this state, I am so proud to say, have passed legislation that addresses, you know, gun control, but weapons are more available. Children's brains are not developed. They're fooling around with it. They're showing off with a friend, and then there's a tragic episode, and maybe one is charged with a crime, or they are, you know, in some sort of posturing back and forth that's, you know, part of being an adolescent and more acute in some of our communities. And, you know, it used to be, you could have a fight. Now you can drive by and kill somebody and not even the right person, you know? So the fewer guns, the fewer tragedies that involve guns. I mean, that's just a point A to point B. And I'm not talking about responsible gun ownership or, you know, any of the things that are part of our national tradition. I'm talking about weapons that are unsecured and available to children. I mean, there's just, that's always going to be a recipe for disaster. They have no use for firearms. They are minors, period. I mean, so if I had to zero in on one thing, but once again, proudly stating that Rhode Island has been very proactive in addressing this, and I think, found a receptive appreciation for it as a safety issue that maybe hasn't been the response in other states. So, once again, I feel like this is something we can solve.
What about parents? What message would you give to them?
Boy, as I say, a parent myself, there's not a recipe, or I'd be following it. But, I think kids are so isolated with screens. They don't even talk to each other. I don't know how many of us have had the experience of, even at a family gathering, you look around, the kids are on their screens. They used to be in the yard, playing football or, gossiping or whatever. And I think that the more you can talk to your own kids, how was your day? It's the old-fashioned stuff works. Sit down to dinner. What's going on at school? I mean, those sound like real, soundbite answers, but it's exactly what we don't really do anymore. Even adults. I mean, we don't. Our FaceTime is with a screen. It's not with another face, and I think we've lost a lot in terms of supporting each other as parents, but also, really looking up and turning and hearing your child speak. No one else can do that but the parent. That no one else can fill that role. So, it sounds like kind of corny, but I think that it really matters to try to do that. Especially when they're monosyllabic. Well, don't put up with that. Press it. That's maybe a simple answer, but I believe it's true.
And have anything else that you would like to say? Your final comments?
Well, I just so appreciate this opportunity, and as much as we are facing so many challenges and uncharted waters, I just really believe in the sincerity and commitment of so many people in our child welfare system who are really committed. People are not just phoning it in this line of work. You can't be. And so I think the staff in our systems deserve support so that we can support kids, and I really think there's a will, the heart is there. We have to make sure the resources and the support are there, out of respect for those people, but out of respect for the children themselves. They see, children get it. Dogs and children always know. They smell out what's real, They smell out when we show that we care about them. So, I think that's what I hope is going to happen. And I feel we are on the cusp of really making some strides, even though we're in a dark moment presently.
Is there any trend that we should get in front of right now?
Well, I have a one-word answer for you. Housing. Housing. You can't be a family without a roof. And right now, we have so many, there's all these terms, homeless, unhoused. It means you don't have a place to live. And right now, the family court, more than we would like, is ordering DCYF to fund a hotel for families. And this is not, please don't picture room service. This is not what's happening. These are extended stay where maybe every room on that floor has a family that has, I want you to keep your children even though you lost your housing. That should never be a reason that a family isn't together. But if you drive by an extended stay hotel in East Providence or Warwick and you see a Christmas tree in the window, it's not because somebody decided to, celebrate Christmas at the Motel 6. It's because they live there. And it is such an acute crisis. It's affecting everything. And that is something that before was the outlier. Maybe someone needed help for first month rent and security. Now, even people with a Section 8 voucher working, these are people working 2 jobs. They can't find an apartment they can afford. And so I can't, that would, I gotta say, if we'd solved housing in fentanyl, I could cut my hours. And I don't say that in a flippant manner. It's just really, that's the percentage of cases that have those issues. And it's more and more frustrating. And I'm talking about staying in that hotel setting in a one room with several children for months on end. I think we just need to pause and consider what that must be like.
I know of 3 former Tuesday's children who aged out of the system, never got adopted, and they're living on the streets.
I'll tell you, I have had the most unfortunate experience of driving by Crossroads on the way home from work. I live in East Providence, and recognizing children who are on my calendar. And once again, I commend Chief Fort and our legislature for their extending services beyond 18, when kids are legally an adult. If you can show me an adult 18-year-old, you must be on Mars, because in middle-class families, we're shepherding them through until their late 20s, and yet children who have the least, to consider them adults as if they can fend for themselves is just not reality. And so through the voluntary extension of care, there is the option for children to voluntarily receive services and support with housing on the condition that they're working or going to school. And it's obviously it has to be their free will to participate, but the number of kids who quote unquote age out and then circle back, because who can make it right now with a college degree and find an apartment? I mean, we have a lot of middle-class people whose children are living with them, for all the reasons that are 1,000 times more challenging for the so-called aging out population.
With everything you have on your plate, how do you stay strong?
Oh, I don't know that I'm strong at all. I mean, that's such a kind compliment, but I really work in an environment at the family court where it's collegial, it's supportive, where we compare notes, we are, touching base. Geez, I had this situation. I mean, we have a lot of support from our chief, who really has been very innovative with a lot of programs, some of the first of their kind in the nation. And I feel like that, when you can go back and kind of lick your wounds or even hear what other colleagues have to say, I feel like that's such a strength we have, because we are a small system, and that's the strength of every system in Rhode Island. I can text a colleague and say, gosh, I had this happen today, and they'll say, gee, you might want to think about, requesting this or ordering this. I mean, there's that give and take all day long. I also think that there's a real future for a more collaborative relationship with DCYF, because I think that we're really getting signals that there's, a lot of interest in solving problems in a collaborative and more efficient way, rather than waiting to the point where we're butting heads over, that case that's got everybody's dander up in the court setting. So, I'm very hopeful about that.